Today marks President Obama's 100th day in office, and tonight we're taking a look back at the challenges the president has faced during his first 100 days in the Oval Office. Joining me now live tonight is Carmen Balber, Washington Director of Consumer Watchdog. Thank you so much for being here tonight.
Thanks for having me, Beverly.
You and your organization have been following the president closely on the matters of health care. So give us an evaluation over the past 100 days. How's he done?
Well, I always think that a 100-day marker for most things, perhaps not the dire economic situation we were in, but for most things is kind of jumping the gun on the grade. But thus far, we would say that President Obama's performed very well on what might be the most important pledge that he made on health care during the campaign, and that was simply to make it a top priority, a key domestic priority of his administration. He's done that by bringing it up in these first 100 days. He put forward a platform and principles for Congress to look at on his health care reform agenda, and perhaps more importantly, he put his money where his mouth is, and he committed over $600 billion in his budget towards first step towards health care reform. So the very first marker, we think President Obama's done very well.
So what's the next marker you want to see, and what would you like to see him do in the next 100 days?
Well, there were two other big pledges that President Obama made on health care during the campaign, and one of them was really the crux of the difference on health care between Obama and Clinton during the primary. That promise was President Obama's pledge to oppose a mandate on individual Americans to purchase private health insurance. President Obama knew what most Americans know, that people don't refuse to purchase health insurance because they don't want it. They don't buy it because they can't afford it. So President Obama, and this was a key difference between him and Clinton during the campaign, pledged not to require Americans to purchase private health insurance. The other pledge was to create a public alternative to that private market for every American to have the opportunity to purchase into. On these two pledges, President Obama hasn't gone back at all, but he hasn't pressed Congress moving forward on those pledges. So we see the chief architect of health reform in the Congress moving back on those pledges.
And what do you anticipate having to do if you don't see the president following through on what he pledged, and if you see those in Congress moving backward?
Well, we've definitely already started to call on the members of Congress to think about what they're doing. I think the individual mandate in particular is a health insurer's dream. What they want is for the government to say everybody has to buy our product. What would Americans be left with but an unaffordable policy that most likely would have very low benefits? We think that President Obama has probably wisely said, Congress, start to shape a reform for us. Now it's time for him to step in.
All right. Carmen Balber, thank you so much for being here tonight.
Thanks for having me.
Really appreciate it.